Hello, welcome back to my channel. Today I'm going to brief you all about intestinal obstruction or bowel obstruction. Intestinal obstruction is a potentially serious condition in which intestines are blocked. The blockage can be either partial or complete, occurring in one or more locations. Both small intestine and large intestine can be affected with the blockage. When the blockage occurs, the food and the drink cannot pass through the body. As you look at the diagram, both the small intestine and the large intestine or the colon can be blocked or affected. The common causes of obstruction, particularly in the small intestine, are the mechanical obstruction, which can be caused by adhesions, volvulus, intussusception, tumors in the small intestine, gallstones, hernias, swallowed objects, inflammatory bowel disease, especially the Crohn's disease. So these are some of the mechanical causes of the small intestinal obstruction. As I said, intussusception is the telescoping of the ends of the intestines, or there could be adhesions in the intestine post surgery, or there could be volvulus or the strangulation of the part of the intestine. Some of the causes of the large intestinal obstruction or the blockage are the impacted stool, colon cancer, meconium plug in newborns, volvulus or intussusception, which can be seen even in small intestinal obstruction, or there could be diverticulitis or the stricture. Some of the non-mechanical causes are paralytic ileus, which can be caused by abdominal or pelvic surgery, infections such as gastroenteritis or appendicitis, some medications including opioid pain medications, antidepressants, and anti-muscarinics. Decreased potassium levels, mineral and electrolyte imbalances, Parkinson's disease, and other nerve or muscle disorders, Hirschsprung disease, and diabetic neuropathy. The symptoms are severe abdominal pain, cramps that come in waves, bloating of the abdomen, nausea and vomiting, diarrhea, constipation, inability to pass gas, abdominal distension, loud noises from the abdomen, and foul breath. The diagnostic tests for intestinal obstructions are an X-ray, CT scan, and barium enema. If you look at the treatment, it is for partial obstruction, we need to look into the resting of the bowel and administration of IV fluids, Ryle's tube insertion to relieve pressure, swelling, and vomiting. Surgery is required if the above measures fail. The common surgery is the exploratory laparotomy, and the corrections depending upon the cause need to be done. The potential complications of the condition are dehydration, electrolyte imbalance, perforation, kidney failure, sepsis, multisystem organ failure, and death. The nursing interventions for intestinal obstruction are allow the patient nothing by mouth, insert the nasogastric tube to decompress the bowel as ordered, begin and maintain IV therapy as ordered, administer analgesics, antibiotics, and other medications as ordered, keep the patient in semifoulis position as much as possible to promote pulmonary ventilation. Look for signs of dehydration, monitor the nasogastric tube drainage for color, consistency, and the amount. Further, monitor the intake and output, monitor the vital signs frequently, and when administering the medications, monitor the patient for the desired effects and adverse reactions. Continuously assess the patient's level of pain. Monitor the urine output carefully to assess the renal function, circulating blood volume, and possible urine retention due to the bladder compression by the distended intestine. And lastly, emphasize the importance of following a structured bowel regimen, particularly if the patient had mechanical obstruction from fecal impaction. Thank you. If you have any suggestions, please feel free to comment about it. And for further information about the health aspects, kindly subscribe. Thank you.